welcome everybody to this October Digital Health Symposium on digital health and human rights, a really important one and timely, given the fact that we have so many human rights issues around the world. We have to think about what is happening today in the global health ecosystem, what's happened over the last 2.5 years, almost 3 years during the pandemic, and how the digital health divide has really widened. So, and it's still widening with the development of machine learning tools and technologies and the training of algorithms and machine learning tools and technologies to develop AI. And AI, by the way, is one of the most rigorously funded, invested areas right now where investment firms are focusing and where enterprises are focusing their resources. A lot of these algorithms, a lot of these machine learning tools are being trained on algorithms based on wealthier nations, particularly in North America, Asia, and certainly in Europe. And that has significant issues for human rights, given that we believe that healthcare is a human right. And given the fact that it is clear that these algorithms are not, and these machine learning tools are not being trained with the lowest income 1 billion people in mind, it's an issue. That combined with the fact that we have a general falling right now of the democracy index globally. There are about 136 countries out of roughly 230 that are democracies in the world, and democracies represent roughly 37% of all people. Roughly 37% of people around the world are living in democracies right now, and that's under threat. And so we have right now an issue. These two and really three major ecosystem changes are happening with democracies under siege, with pandemic, and now another round of COVID coming around the world, and then also with this general issue of this digital health divide now amplifying dramatically, where we need to, as digital health leaders, we need to take it upon ourselves to make it an imperative, to make it a priority, to actually make a difference now before it's too late. And so along those lines, one of those folks that are making a difference is our next guest, and certainly our two next guests, Catherine Skobe from Pfizer and Chris Winchester from PharmaGenesis. Chris and Catherine, welcome to the program, and thank you for joining us.
Thank you, Stan. It's great to be here. Hi, I'm Catherine Skobe. My role at Pfizer, I'm based here in New York. My role at Pfizer is Publications Innovative Solutions Lead. It's a mouthful. And I work on I co-lead the Publications Management team. So I'll turn it over to Chris to introduce himself.
Thanks, Catherine. My name's Chris Winchester, and I'm CEO of Oxford PharmaGenesis, and we help clients in pharmaceutical companies and more broadly to communicate and disseminate and disclose the results of the research that they fund.
Great. Thank you. So, Chris, I'm obviously very excited to be here today so that we can speak on digital health and human rights. Also, as you know, is Open Access Week, which is a big thing here at Pfizer. And this year's theme is on climate justice. In my mind, it's all about the same problem we're trying to solve for: human rights, impact of climate change on healthcare, and obviously accessibility to information to improve health outcomes. So I'm wondering, what are your thoughts on how open access can play a role in affecting human rights, particularly as it's related to improving health?
Well, thanks so much, Catherine. In preparation for this session, I did my homework and I looked at the Universal Declaration on Human Rights. And Article 27 states that everyone has the right freely to share in scientific advancements and its benefits. And that really aligns, I think, as a baseline, then people should be able to see what research is happening so that they can actually engage with it. And that's particularly important in medical research, which after all is typically done with, on, for, in collaboration with human beings. And so making sure that the results of clinical trials and other research is actually available to the people who took part, I think is ethically important. It also makes good sense because people often are then motivated to take part in further research, and I think it can build trust in research as well. Certainly, if you can read the results rather than coming up against a paywall and thinking, right, oh, what's this sort of secret stuff that I'm not allowed to see? So I know that, Catherine, you've been a real advocate for open access, and I wondered how that aligned with what's happening within Pfizer, what led to it, and what are you seeking to achieve?
Sure, thanks. That's a great question. As I mentioned, it's Open Access Week, and this is our third year really focusing on educating both our internal colleagues as well as those investigators that we're working with, as well as the patient advocates that we work with. So we spend this week really dedicated on sharing resources and materials to help our stakeholders understand what that means. I mean, really, it's about accessibility, as you say, to healthcare information. We spend, tremendous amounts of funding and time doing, life-changing research. And if it's not accessible to HCPs, particularly those in, community physicians or physicians or healthcare providers in low and middle income countries, what's the point really about getting that information out there? So we also partner with a lot of great organizations like Open Pharma, which you co-founded. Wiley Publishers has been doing a tremendous amount around open access and making sure that they can assist with Plan S and Coalition S and what they're trying to achieve. And then at Pfizer, I mean, really, our mandate or goal has been over the past couple of years is to hit a target of 95% open access publishing, so that we can really get the information into the hands of those who need it to help change health outcomes. So I'm going to take a second here, Chris, to pivot, because I know another topic we like to talk about under the premise of human rights is diversity, equity, and inclusion. And we've spent time, over the past several years really trying to relay that information within our professional field. And so having written an article together a couple of years ago for a medical professional organization, I'd love to hear what progress that your team has made since then, and the projects that you guys have been working on.
Thanks so much, Catherine. Yes, when we put together that roadmap, I remember we were keen that it was outward looking. It wasn't just about what can we do in terms of our own colleagues, workforce, etc., but how is this thinking going to shape our engagement with the wider world and ultimately make a beneficial difference to health outcomes. And so at Oxford PharmaGenesis, we're very proud of the projects we're involved in that are advancing diversity thinking. So if I give a bit of background perhaps on each one, I don't know if you're aware, but currently 85% of the human genomes that have ever been sequenced are from white people with European ancestry. And so when you think that actually the birthplace of humanity is in Africa, and that's going to be where most of the genetic diversity is going to be located, it's a bit of a miss. So we're so proud to be working with Genomics England to help understand defining diversity in genomics and support their work in improving diversity in genomics research. And I think that aligns nicely with Stan's comment earlier about making sure that we're working with diverse data sets. We're also, in a similar vein, supporting with Pfizer, as you know, the Centre for Information and Study on Clinical Research Participation, or CISCRIP, a non-profit that is advocating and encouraging diversity in clinical trials. And then we've been doing sort of things like the patient advisory boards to make sure we've got insights on sexual health from all sorts of different sexualities, running online conferences for people who can't always attend international conferences, even focusing on topics like the menopause, which I think are really important. and even helping to publish evidence on management of diabetes during Ramadan. So, I mean, it can just be, once you start thinking about it, you're just, you can't stop really. It's so stimulating.
It is so interesting, and there's so much work that could be done. So I also know that you've been working on helping build the next generation of scientists and really focusing on diversity and inclusion there. So could you tell us a little bit more about that too?
Oh, thanks very much, Catherine. Yeah, we've had an opportunity to fund a doctoral scholarship at the University of Oxford in the Department of Primary Care and at Green Templeton College in Oxford. And the topic is on diversity in medicine. And so we wanted to do something that would be thought-provoking and also help to develop a thought leader who can help shape medicine, to be ever more diverse in its thinking. And you may know that actually people with darker skin are less likely to develop skin cancer, which is, good news. But on the other hand, if they do develop skin cancer, the outcomes are a lot worse. And historically, people talked about education, socioeconomic status, but what no one mentioned was that actually all the textbooks only showed white skin. And that's only just coming out and being addressed now. And so we are funding at this student to look at this in the era of AI, where we've got to have diverse data sets, or we could just bake in such injustices.
Wow.
How are we doing for time, Stan? I think I've got one more question I'd love to ask Catherine if we've got time.
We're running a little bit behind schedule. I apologize, but yeah, if you want to make it like a 1 minute question answer, that'd be great.
Okay, all right. So, Catherine, you've been doing some fantastic work with patient advocates on how scientific publications are developed and communicated. What are your thoughts on this and what this means for health literacy and human rights?
Sure. Yeah. And I will be brief, Stan. So we have formed a collaborative board of patient advocates across various therapeutic areas, really to help us be better at what we do and how we communicate, and being more informed in how we do that and our approaches and formats that patients want to see. So we've been very conscious about making sure we're diverse in our, board membership in both geography and therapeutic areas, covering, gender, race, ethnicity, and just because we need that those perspectives, and making sure that the scientific information that we're producing can really help drive health equity and health literacy. So that's been really important in the work that we've been doing. I know we're out of time. If anyone has questions, feel free to reach out to me or Chris via LinkedIn or email. Thank you so much.
No, it's wonderful. Thank you, Chris. Thank you, Catherine. And that is, again, another illustration for the audience here today on how you can take steps in your enterprise, in your department, in your division, in your team to move a little bit closer to what's happening with human rights and digital health, and how to move the ball forward in digital health and human rights. It's not something that has to happen just from the United Nations. It's not something that has to happen just from a national government standpoint. It is something that can happen in every single one of every single one of us, and what we're doing every day. If we take a little bit of time to think about how we can have better representation on our advisory boards, how we can have better representation in our communities, to ensure that we're thinking about people of all colors, of all incomes, of all regions, when we're building our algorithms, when we're building our AI tools, whatever it might be. That's really the point of what we're talking about here today. And it's across all mechanisms of human rights, which hit close to home here in the US as well.